Hello, my name's Aaron Haley and I'm the Internal Communication Manager for Betsi Cadwaladr Health Board in North Wales. The NHS in Wales is split up in 7 different health boards as well as some other tertiary services. And basically, this is how we organise NHS services throughout the country. So it's a population of about 3.6 million people. Up here in North Wales, we are the biggest health organisation in Wales. We care for a population of about 700,000 people. And all of our services include everything you can think of in terms of health services. So that's everything from your paediatrics, your neonatal services, maternity, women's services, through to cancer care, specialist things like cardiology, mental health services, and obviously through to end-of-life care and palliative care. So it's all services under one organisation. We've got 17,000 members of staff. I think we're one of the biggest NHS organisations in the UK, and a budget of £1.6 billion every year that we use to deliver all of those services in partnership with our local authorities and trusts over in England over the border as well. So in terms of our demographics in North Wales, we've got a really diverse range of cultures, of lifestyles. We'll have from really rural communities with very small local hospitals that would care for them, through to some of the bigger populations, places like Wrexham, Llandudno or Bangor, that are obviously big sort of student towns or certainly where our concentrations of populations are. So there's a real difference both in terms of our staff and in terms of the people we care for, right across the 6 counties that we care for up in North Wales. We've got 3 district general hospitals where our services are broadly focused. So that's Ysbyty Gwynedd over in Bangor, Glan Hospital in Bodlewyddan in the centre of North Wales, and then Wrexham Myler Hospital over in Wrexham, which you might be familiar with. It's a place that Ryan Reynolds has recently invested in the local football team. On top of that, we also obviously deliver all of our primary care services, 109 different GP services, as well as our pharmacies, our opticians, dentists, and other sort of high street services that you might access. So that all falls under one organisation as managing and maintaining those. And I'm obviously working the communications team for that organisation, covering our internal communications. And over the past 5 years, I've moved on from a role of being a central area comms officer, so that's caring for 2 of those counties I mentioned, and very recently took over the internal communications function, which I'll talk about in a little bit more. We've really gone through a big journey over the last 5 years at BCU of really trying to modernise and change the way that we function as a team. There's been significant investment as the team in terms of how we do it, how we have more staff. We've gone from a team of maybe 5 or so when I started in 2016 to 13 now, so we've more than doubled in terms of our staff numbers. And really, it's been a lot of change for us in terms of how we actually manage and maintain our services. Initially, there was a big focus about our external facing comms. So we've really changed the way that our press office functions. My colleague Rachel's done a wonderful job of changing our website and also our social media offering, really bringing it up to speed with what you'd expect among some of the best ones throughout Wales and certainly in the UK and some of the NHS, in my opinion. And also looking at much better align our function and our services with the wider organisation goals as well. And that's something that I know I've been involved in and all the other members of the team have done. It sort of culminated into winning we won the CIPR Team of the Year award back in 2019 for our work. So that's really some good independent kind of verification of the work that we've been doing. And obviously we're going to focus a little bit more today on the internal comms side of things, how we've tried to change that up over the last few years. So in terms of what we've got in terms of how we share information with staff, we've got some of our tools and our channels up on the screen there in front of you. It's fairly straightforward stuff is what we've come from, what we're working towards now is hopefully trying to innovate a little more in terms of what we've got. So when we started back in 2016, we had our website, we obviously had intranet, which you can see on the screen there as being really outdated and outmoded. Email and obviously our social channels as well as our kind of primary ways that we were sharing stuff with staff. And what's pretty obvious from looking at that is that it doesn't really do a lot for our staff who aren't particularly digitally enabled. So if you're like me, you're working behind a desk all day, you've got a computer, you've got easy access to the website, to the internet, to email, social if I need to on my personal devices. But if you're a member of staff, maybe you're working 12-hour shifts on a busy ward with one ward computer to access, it's not ideal that we're going to be able to share those messages and staff content with you because obviously you're not particularly unable to access them. And this is something that we sort of knew about, we were aware of it being an issue, but we didn't really have this kind of business case to be able to do the work to change that back in 2016. So the first thing that we really did was did a big survey, a big audit of our work, and this sort of took place in kind of autumn 2017. We went out and spoke to 1,400 members of staff through a survey that we carried out as well as face-to-face interviews. So that was divided up into about 1,000 survey responses that we did via the channels I just described a minute ago. So that's through email, through putting a link on our intranet, and through some other digital ways of sharing that information. But we also did those 400 face-to-face interviews. There's the graph you've got in front of you there really starkly shows there's a real discrepancy in how our different groups of staff access information. So for people like me on the left who have a computer and who access their emails, it's very easy for us to get our stuff through the channels that are obviously identified there. Completely different if you're a frontline member of staff, someone who doesn't use a computer. You're reliant on your line manager to share information. And we know that line managers are already under pressure to share stuff. So if we go to them saying, can you share this latest information about whatever it is, we know that's probably not their biggest priority for that day anyway. It's probably managing the actual ward. It's probably dealing with staff issues, probably dealing with patient issues. So we knew that we needed to do more based on this piece of work to support our staff who were not digitally enabled. And part of that work was really around making sure that we asked them how they want to access information. I come from a print journalism background. One of the things I thought people would really like would be a nice printed newsletter, a glossy document they can look at on their lunch breaks or whatever. It was a resounding no on that. People did not want a printed newsletter, and that's fine. The whole purpose of this piece of work was about understanding how our staff wanted to access information. What they really did tell us was that they were really interested in being able to access content and information on their own devices. As you can see that 85% of those 400 odd interviews that we did said that they would be welcoming if I'd be a way of accessing content from the communications team, from the organisation on their personal device. And really that was the mandate that we used to go and procure an app to look at what solutions were out there on the market and to say, this is what our staff have asked us to do. This is what we need to do to take our communications to the next level, to be able to share stuff with staff and to really make sure that they are receiving the content that we are already generating, we know is out there, but isn't necessarily getting through to them. So that's what we did. We went out and looked on the market at what products were available. We did some road testing. We spoke to various companies. We ended up with a company based over in Surrey who really supported us with developing a product that was going to solve that problem for us, really. At the time, we think we were pretty much the first NHS organisation in the UK to use an app of that kind. But really, it had some specific kind of tasks that we wanted to achieve, which I'll talk you through very shortly. And we really worked very closely with them to overcome some of the challenges we had in terms of IT, in terms of security of data, and also from a usability point of view to make sure that we were really delivering what we knew from that survey results, from that piece of work that we did, what we knew our staff wanted to access. In terms of what it was doing, we asked our staff about that. They were really clear that they wanted to be able to access news. They wanted to be able to access platforms like EOL, ESR, and MOL, which are platforms that help people manage their rosters. It helps them do their training. They're all browser-based, so we worked with the company that we worked with to make sure that they were available within the platform. And then it was also about making sure they were able to generate their own content, share their own updates without needing to come to the comms team, without us having to hold a hand in doing that. So we tried to make sure we had a solution of something to really open up the channels so people could do that themselves. It was also about making sure there was a robust document storage area. And there were some other platform benefits that are alongside that, such as quizzes and diaries and some other things that were also beneficial to us. We were able to sell in alongside developing the app. That's really where we came to in terms of procuring the product. We did a load of work to make sure that it was pen tested, that it had done through all of the work that we needed to do to make sure that we had a product that was really bespoke and right for our staff and really addressed the problems that we'd identified. We knew were a problem in the first place anyway with that research that we carried out. And that's kind of where we got to. So we worked really hard, as I said, with our IG and IT teams. They were really key partners in procuring and developing the app and making sure that it was taking care of the stuff that we as a comms team simply would never think of. I've got no background whatsoever in digital or in IT. And clearly, it's not the right person to be deciding on how secure a platform is. So it's really important that we have that buy-in from our colleagues elsewhere in the organisation to provide their expertise and provide their side of the equation as well, really, with it. We went through a load of processes to make sure it was secure, so they would only log in through their own work email address, and a separate piece of work about how to make sure staff knew what their email addresses were in the first place. Because, speaking to those people on those 400 odd interviews that we did, there's a load of issues around the fact that they're so poorly digitally enabled, they simply don't know what their own email address is. So there's a load of work that we went through to make sure that this worked properly for everybody, that they had the right tools to be able to get onto this channel in the first place. We made sure as well that it was very clear to staff that this was entirely voluntary. We didn't want people to feel like they were being coerced into downloading work on their home phone, or feeling they were being looked at by the organisation. It was really about doing, like you said, we did, kind of process of saying, well, you asked for this as a platform, this is what we provided, but it's entirely up to you. If you want to take it up, that's absolutely great. But if not, it's not for you, that's absolutely fine too. It was really clear and important to us that we made that clear to staff from the off as a way of really giving it credibility to the project, help people to understand what they were signing up to by joining in the first place as well, really. And finally, it was also important for us to make sure that we had a solution that was available on desktop and on app. So what we found was that we've obviously got a lot of content creators, as we sort of call them generally, people who are really proactive in sharing stuff, having news and having updates. But from their point of view, it became difficult for them to have to download an app and recreate what they'd already done on their work computer on a mobile device. It was really important that we had a desktop solution as well, so that they could very quickly copy paste their content across into a simple platform to share it with people on mobile. It was kind of something we didn't really think about in terms of the procurement side of things until we really got to the point where people were saying to us, well, I don't really want to recreate this on my phone. I want to be able to just do it straight from my work computer. And that was really something we learned going through that whole kind of process, really. So we launched the platform itself back in March 2019. Over the first 4 months, we got really good buy-in. I think we've got more than 4,000 users signed up. We've got more than, there's about 60 different locations throughout the organization we're now organized in, but at the time we launched with about 40 based on geographical locations in BCU. So we had content from across all of our 6 counties posted their early doors, making sure people were really getting involved in it. And as you can see from the numbers on there, there was some really good engagement early on. And I think that over the first sort of 4 months or so, we were quite quietly confident with progress. We were getting where we wanted to be. And really looking towards the end of 2019 onwards, we were thinking that this is a really good opportunity to kick on, try to reach out and get more of our staff up on board. So, 4,200 members is roughly 30% of our overall workforce. And I think the target was to get 50% on board, given that we knew that a broad number of the staff we really wanted were those people who were already poorly digitally served. And they were really the target group who this was about benefiting. So we were on course at that point and pretty happy with where we were up to. And obviously things changed in 2020. And obviously COVID-19 happened and things went out the window, but that's fine. What we actually found really was that towards the end of 2020, towards the end of 2019, for various reasons, we'd plateaued a little bit in our development and we had some other priorities we had to look at as a team, which shifted some of the resource away. But by the time COVID started to happen around early 2020, it was actually really beneficial that we'd done that prior work, that we'd already got a good user base built up on the app, and that we had a bit of a head start, really, being able to have a solution to share stuff with staff who we knew were poorly served, particularly given the stuff around COVID was actually, it was impacting everybody's work, obviously, but it really made a difference to those staff who we knew were poorly serviced by our digital channels. So we were really lucky, really, in a way that we'd done this work, that we'd thought through how we communicate with that particular group of staff, and how we, had come to a solution that was working for us, that we had some buy-in already, so a good level of buy-in really already. We were able to kick on with that. So in terms of looking at the app specifically, we made sure that that tied in with other measures that we've taken throughout the rest of the organization of collating all of our content into one area. So we created a new stream on the app where we had just our COVID updates and information. And as it went through, those early months throughout March, through April, through May, there was daily updates going on that channel with our latest information, how things were changing, how that impacted our staff. We'll talk through some few examples of that in just a few minutes, as to exactly what kind of content was going on there. We also, from the middle of March onwards, there was daily briefings that went out from the organisation, from our chief exec and from our chairman, which had all the kind of information that on a daily basis that people needed to know. So that went out on an email. It was replicated on our app, so there was a push notification to people's mobiles to access that information too. And it was also repeated on our intranet. So really, we had those 3 key channels that we used to make sure that we were doing all we could to make sure staff could access our updates and our information. There was also a document library that we managed and maintained in accordance with another document library on our intranet. And we made sure that the two kind of were matching each other in terms of content, in terms of making sure that staff had the right information that they needed to access. So that's really the kind of focus that we had in those early days, alongside doing everything else that we had to do around COVID. In terms of some of the numbers specifically looking at the app platform, you can see on the screen there, we got a real spike of users of roughly 700 or so people signed up in those first few weeks. We're now at a place where we've got 5,500 people registered on the app. We saw, I think, a high point of about 17,000 users logging in, 1,700, users logging in on a daily basis to get those updates. So we knew that people were looking at the app, they were using it as a way of getting the latest information from the organisation. That was really heartening, given all the work that we'd put into that date to really reach that point. We also knew that some of those other platforms that were really important to us around providing a single link through to ESR, through to EOL, were also being routinely accessed throughout this time. So we knew people were coming to the app to do, perhaps to do their mandatory training, but they were staying for the information on the COVID or staying for the information elsewhere from the organisations. Again, that was another big tick for us because of what we'd set out to kind of achieve with all this in the first place. And that's kind of where we were at that particular point in time. So that took us up to the end of 2020. And it was really important for us to have that app channel as a way of making sure that our staff who we knew didn't get that content through our digital channels were really accessing what we needed them to. In terms of a few specific organizational, a few specific examples, sorry, we know that a big thing around the start of COVID was around misinformation. It was a frightening time for everybody, staff included, as well as our public. We saw a 250% year-on-year increase in press inquiries at the time. And that by press inquiries means separate issues that people were coming to. In March alone, we had 104 different issues that press were coming to us and asking. So it really put a massive strain on the comms team in terms of our resource and in terms of our time. But we had to also make sure that we were continuing to service a lot of different customers, our staff included, in doing that. So certainly we were using the app as well as our other channels as part of a broader strategy to make sure that we were addressing misinformation. We were sharing updates as timely as possible. We were keeping information about what we were doing about testing centres, around our hospital numbers, around our PPE allocation, all these other different issues that were all sort of big ticket items at the time, and making sure that we were keeping on top of keeping all of our staff and our stakeholders and the community and our press contacts and also our public as up to date as we possibly could be in what was a really rapidly changing environment at the time, really. So in terms of some of the other stuff that we did, PPE was a really important one. And what we saw in particular with that was around rapidly changing guides around what PPE to wear in different areas. So again, we really utilised the app as a way of making sure that staff who that directly affected had the latest information. We were sharing infographics like the one on screen here that you'll notice is bilingual, because obviously we serve a lot of Welsh communities, or Welsh speaking communities, as well as our English. And really it was about making sure that we were using channels that we knew our staff were accessing or that was directly getting to them as a way of managing that misinformation, managing around people's anxieties around what was the right PPE to be using, what amount of PPE do they have. That was another really key one actually around the allocation of PPE. There was obviously a national, a global scramble for making sure they could get hold of the right equipment. Part of what we did as a comms team was to support some of our colleagues in procurement and our colleagues in our charities arm to take over that process of receiving generous offers from our communities across North Wales. We've got a lot of food production, for example, a lot of agriculture, a lot of other communities that already had some of the materials that we needed. I think we received around 1,400 different offers of support for PPE and other benefit of kind for our staff. And what we really used our channels to do was for the outbound stuff to really make it clear how to donate, because obviously there's different grades of PPE, of different things. We also had to bear in mind, the sort of COVID security of accessing some of this stuff and making sure people were safe in donating as well. A lot of our outbound content was around focused on how people could do that appropriately, making sure the right information was clearly available to people. In terms of our staff channels, it was really about making sure they were clear how to accept them. There were cases of people rocking up at hospitals just to drop off, whatever they could. And really what we tried to do was coordinate that so that it was all donated in single hubs, so there were single places and drop-off points where staff were properly trained and managed to actually do that process in a timely and sensible way, in a COVID secure way as well, really. So again, it was about utilising the right channels to make sure that the right people were getting the right information. And that's kind of how we try to combat some of the misinformation, particularly around that particular issue. Another issue we had as well around the time was around staffing. Obviously, towards the middle and towards the end of last year, we opened up 3 field hospitals, which we had ready to manage what we had perceived at the time as being an influx of COVID patients. We felt there was a need for additional capacity to be able to care for those people who may have needed it had we not had the vaccination program come in later on down the line. As it turned out, we didn't need to use those facilities, but we did have 3 separate COVID hospitals that were converted from a local theatre, a community centre, a gym, and an ice rink, as well as leisure centre, converted into temporary hospitals. But as part of that work, we also had anxieties or concerns around the amount of staff that we had to populate those additional pop-up hospitals. And so one of the campaigns that we were involved in that we really used our staff-facing channels to do was around the campaign you've got in front of you here, which is Betsi Needs You. So this is around speaking to our staff and encouraging people to return from retirement or to come back from private care or to step in as voluntary roles as additional ways of bolstering our workforce and getting additional staff in. And really what we focused on our staff channels around that was around speaking to former colleagues, speaking to people who'd retired recently or who'd left the nursing or HP or doctor profession, to try and encourage them to come back and do some of that work. And again, the app played a part of that, pushing some video content, some direct appeals to people to come back and work for us during what we saw as being a spike in terms of needing additional staff. Again, another real concern that we had around the time was around our staff well-being. Obviously, COVID's been incredibly stressful for everybody involved in it, and in particular, with those frontline healthcare staff who are obviously delivering the care directly to people. And I think became very clear early on that there was additional resource needed to be able to manage and maintain our staff's well-being, to provide that additional support. Obviously, some really harrowing and terrible sort of things people were dealing with, particularly in our respiratory wards and our elderly care wards, and throughout NHS, really, with anybody's care, to be honest. So again, one of the things we really made sure we tried to push and make clear was how to access additional health and wellbeing advice. And again, as an example of that, on the screen in front of you there, some of the posters, some of the information that we shared around that. And again, the app was a really key way of us making sure that we had that channel available to directly reach people who we thought were in particular need of accessing and needing that support, or at least referring that support onto their colleagues who may also need it, really. So that obviously sort of took us through in a really whistle-stop way what we did throughout COVID. And you can see on the graph now, in terms of some of our use, some of the high points towards the end of last year as to where we are now, we have seen a drop-off in terms of people accessing and using the app itself. But we're quite comfortable with that. I mean, we're at a position now where we know a lot of people have got it on their phones. And really what COVID has taught us is that the product is there, ready for when we need it. We can roll it out if there's an emergency. People know to go to it as a source of information. They know that it's available as a way of getting stuff direct from us as an organisation that, going back 2 years, simply wasn't available to us. So, it really has kind of told us that it's doing what it needs to be doing. And we're still getting a regular cohort of people who are using the product and still accessing our services through it. I think one of the things to really take away is that it really told us quite a few things about what we're doing, in terms of our staff communications that we've learned from now as well from that. So I think the key one, really the biggest takeaway for me, is around opening up that two-way conversation. What the app really did for us was it helped us to broadcast information to our staff. I think now the next step on that is really opening up channels for staff to be able to feed back to us what they need. But looking back at COVID, definitely from my point of view, I think we could have probably done more to make sure that we were fielding queries from staff or getting their feedback on what we were doing and making sure that there was a way of them accessing the information that we'd provided, or providing additional assurance that they were getting that information. So definitely that's a big focus for us going forward, and the app solution will be part of that. Another really big one as well for us, I showed you a screenshot earlier of what our intranet looks like. We've got a big project on now about launching a new intranet, and central to that is absolutely making it available on mobile. Because we know that there's a huge number of our staff who are not well supported digitally, as we've just talked through for the last however long. So making it available on people's mobiles, on their personal devices, on their laptop at home is really central to how we're going to take that particular piece of work forward, and integrating that in with the app or with our other channels of sharing information with staff is a really important thing that we learned, because obviously sharing those notices and those pieces of information with staff and having a document library is really good to a point, but being able to direct them to an actual intranet resource or to the content that you're talking about really takes it to the next level for us. And that's what our aspiration over the next 12 months is really going to be around. And then finally, I think the other sort of takeaway from it is really how we maximize the people who are really engaged in the work that we're doing. But really what we're trying to do at the moment is to really generate a kind of field of our kind of champions, our communication specialists, people who we can rely on to go and share messages from the organization, who we know are on the app, for example, or who are routinely sharing content with us in the first place, and really open up a better service to those groups of staff, those busy people who we know in all of our organizations, who are really good at sharing stuff, who are kind of community hubs, if you want, of their particular department or their particular area of work. So really we're doing a lot of focused work on that at the moment as well. And again, tying them into sort of promoting the app, promoting some of the other work we're doing, some of that engagement work is really crucial to some of the other stuff that we really learned from COVID, from the whole process of rolling out an app and challenging the misinformation. I hope that's given you an overview of some of the work that we've done recently. As I say, we're more than happy to hear from anybody who wants to get in touch with any further lessons that we learned or any of the processes. But I hope that's really beneficial for anyone who's listening to how we've rolled out an app and really used it to challenge some of the challenges that we've had over the last 18 months, particularly with COVID. Thanks very much. Bye now.